Hi everybody, Dr. Dennis Mariano here. Today we actually have a case that we're documenting, and we wanted to show you some information about what we do in our practice with regard to sports chiropractic. So this is Allie. So tell us what happened.
I twisted and sprained my ankle this morning.
Mm-hmm. And how'd you do that?
I fell down the stairs.
Okay, so you're a little embarrassed about it?
Yep.
Yeah, it's okay. It happens to the best of us. So our approach is, instead of just looking at the ankle and to see if it's injured, so what happened already, they already did an x-ray, correct? Mm-hmm. And there was nothing on there that showed up. Although you have to be careful, because sometimes when you x-ray something that's acutely injured, there's swelling in there, and then what could happen is you can actually hide a fracture. It could be a hairline fracture or something. So as far as we know, there's nothing. But what we're going to do today is intervene in a natural way so that this way we can allow the body the best opportunity to heal. The most important thing, besides looking at the ankle, we need to be sure that the entire nervous system and the whole musculoskeletal system is in balance to take pressure off that area so it can heal optimally. So the first thing we're going to do is actually muscle test that. So what we'll do, you just stay where you are, Allie, and put that leg down to the other side there. Hold this arm. Okay. And hold strong. Push against me. Good. And we're just challenging. Yeah, right there, it's not happy. Hold here. Looks like we do need to adjust that area.
Oh, is that gonna hurt?
A little bit. You ready?
Mm-hmm.
Tender? Yeah. Yeah, it's inflamed in the area. So what we want to do, if there's any misalignments at all, that you want to correct all that first. Hold strong. Yeah, and then we actually need to adjust your toes. Here's a good tip, by the way. Let's say you're in soccer and you twist your ankle. The best thing you could do, what they found, they don't know the mechanism, but when you actually adjust the toes, it allows that to heal faster. So back up a little bit more, Al. Good. We're going to adjust the toes here. And we know it's sore. Okay, hold this again. Now take that off. Is this from urgent care? Okay. Take a look at the ankle here. Okay. Did they ask you to take any meds or anything? Okay. Good. All right, so what we're going to do next is to check your whole spine and nerve system. So come lay down on your back. Yeah, lay down like that. Good. First thing we're going to do is to see if you're, okay, hold this leg here. I'm going to push, turn it in. I'm pushing inward, you push out. Ready? Good, relax. Push out, hold. Can you see that? All right, so what typically can happen, which people never look at, if you traumatize one part of the body, the rest of the body compensates for it. So a lot of times when you have an injury like this and they just deal with the actual injury, you miss the rest of the system, and then it takes a long time to heal. And these are also the people that have chronic issues that never heal properly because the whole system is misaligned. So we're going to analyze that now. We analyze that there's something wrong with the upper neck. Hold. Yeah, there it is. So we need to make a correction there. And this is an instrument that we use called the arthrostim, and it's really very gentle. It makes a very gentle correction. Turn a little bit more. Good. And we'll check again. Push out again. And that's much stronger. And push out. Good. Another mechanism too, that anytime you traumatize any part of the body will actually shut down myotomes, meaning these are nerves that control muscle areas. So the body's trying to protect itself, that if you have an improper alignment somewhere, and if you have proper contraction or normal contraction, you'll actually make the problem worse. So the body will shut down different areas, and we're going to check that now to be sure that they're not shut down. Hold this now and resist. Turn it out. And that one is. So that's not good. Hold this now. Put that by your side. Hold strong. And this nerve root to that is not working. Relax. We're going to laser. This is a cold laser. And get it to work. You have to put it on brain frequency. There you go. Good. And lift that same leg again. Hold. Good. Turn it in. And raise that. Hold it. Turn it in. And turn it in. Good. Relax. Hold this arm. And resist. And that's fine. So sit from that position. And hold this now. Hold strong. And if you come back here, we'll show you where the misalignments are. So when she fell, this part of her spine became misaligned or subluxated. And you can see because the arm goes weak when you touch that area. And here as well. So put your feet up here gently. Be careful with your ankle. And to make the correction, I'm going to do this. Tuck your chin. Come back. And breathe out. And sit up again. And breathe out. And sit up again. Do you feel that?
Yeah.
Yeah. Hold this arm again and resist. Hold. That's better. Okay. Come lay down on your belly. Again, what we're trying to do is balance the system to take pressure off of it so the system can heal. Bend both your knees. And can you see the difference here? So this is already asymmetrical because the whole sacrum is rotated this way. Relax now. Bend both now. And you can see the correction immediately. Bend this leg and hold strong. Hold it. Hold. You can come a lot closer if you want to show the adjustment here. Bend this again. Hold. That's your tickle spot. And the stomach nerve's not working right either. Tender, ticklish.
I'm so ticklish.
Hold and hold again. Hold. And that's better. Good. And then raise that leg straight up as high as you can. And down. And the other side. And that's relatively symmetrical. So have a seat for a moment. So just put your ankle up there, the injured one. Okay. And we'll check if we need to do, again, we're muscle testing, analyzing, we do. So if we used a laser, it said would be beneficial, acute injury, inflammation. Good. Inflammation for about 3 minutes. Okay. So what we're going to do is going to use the laser on there. And what the cold laser does, it allows the system to heal faster by increasing the mitochondrial ATP in the cell. It also lowers inflammation. And allows the white blood cells to penetrate the area so healing can happen at a faster rate. And we'll do that for about 5 minutes. Okay, so we're back. So what we just did is we actually did a laser for 5 minutes. What we're going to do now is use the kinesiotape to actually stabilize the ankle. The difference between kinesiotaping and a brace will stabilize it but immobilize it as well. So what we're hoping to do with the kinesiotape when we apply this, it's going to give the body the capacity to glide the skin over the fascia so that the inflammation can decrease and allow healing to happen at a much faster rate. And we're going to check this again afterwards as well, after we do the taping. So what I want you to do, Al, be careful, turn around this way. And then just put your knee facing, yeah. There you go. Okay. And the way we apply the kinesiotape is you're going to put this in the neutral position. And the first thing we're going to do is put one here. Stretch it about, keep it neutral like this. Keep it about 25% stretch. And then this one will go across here to support it. And then the last one, go here. So be careful and try to see if you can walk on that. Just follow her closely there. See how that feels now. What's it? Yeah, turn around. Just walk again. What's the intensity of the pain?
It's like mild.
Mild? Okay, how is it compared to being in the brace? You can have a seat now.
It's about the same. That
About
felt
the
like my
same.
ankle was moving less.
What's that?
That felt like my ankle was
Right,
moving
okay.
less.
So what we want to do is we want to muscle test to see if you had the brace on, which would be beneficial, right? So just imagine that. So if you had this on, 1, 2, 3, 4, 5, 960. So just with that alone, they're pretty even. However, I would prefer to have that, unless it starts to really hurt, then you don't want to, and then you want to use this. But for now, that has an advantage again because it allows the fascia to lift over the skin, and then it allows circulation to ensue as opposed to being inflamed. So the next thing we're going to do is support the body by feeding it good nutrients in order for the tissue to heal, as opposed to just taking medication to suppress the symptom. What's the problem with that? When you suppress the symptoms and you don't feel the pain, you're going to do more damage because you'll still be using it. Ideally, she shouldn't really be doing anything for the next several days, but she has a competition coming up now, so that's going to be up to her to, athletes are like that. They always play hurt, but that's going to be your choice. I'm just scanning. So this is Xymane. It's for acute injury. There's some nutritional protocols in there that'll help the tissue heal. So we're scanning that now. Hold strong. Good. And it says yes. We can dose it. Is it 1 per day, 2, 3, 4, 5, 6, 7, up to 8 per day. So you spread that out every hour, an hour and a half or so, and that'll actually, I've used this in my own when I had a tooth extraction. So I tried it in my own thinking, wow, that's beyond the holistic approach because that's a wound. And so I was given a prescription for oxycodone and also for ibuprofen, I think 500 milligrams. So I tried it out. So I used the laser. We have another laser here. And there are different frequencies on here. I used it on the extraction for 5 minutes on wounds. I used 5 minutes on inflammation, and I used 5 minutes on pain. And I did that about 3 or 4 times. And then I did the Xymane, the Salazane, the omega-3, and then I was able to sleep that night. So everybody's different, but the most important thing is you give the body an opportunity to heal naturally, and when it doesn't work, then you use the medications. So Xymane is 6 per day, right? You okay? Okay.
Yes, we got me through it.
Okay. Let me know when you're ready. Okay. And then hold that now. So that one's Salazane, and that one has for pain. Make sure. Hold. That's good. Are you okay? Sorry. Okay. Okay. Hold. Yeah, up to 6 of that one also. This is omega-3. Fish oil will reduce inflammation. It's anti-inflammatory as well naturally. 1, 2, 3, 4. Wow, it's a lot. You really did a job on that one. So this one is 6. Can you remember all that? I think it was...
Up to 8.
Yeah, Xymane is
up
8.
To 5.
This one I think was 6. And then this one was 6 also. Let me see how. So frequency for the laser, let me see here. How many times a day? 1, 2, 3, 4 times a day today. And then tomorrow, about 3 times or so. and I'll show you what kind of frequencies you'll need. Any questions?
No, I think we're good.
You sure?
Mm-hmm.
Okay. So that's our protocol, and that's what we do when you have an injury. And according to the research, when you use the laser on an injury between 4 to 6 hours, you can actually cut down the healing the time of that injury by 60%. So that's what our hope is. Everybody's different. You know, we're having high hopes that she'll be able to compete. Ideally not, but it's up to you. We wanted to actually document this to see how the progress is. So my name's Dr. Dennis Mariano. So if you found value in this video, please go ahead and give us a like and also make some comments below to stimulate some conversation. If you know people that are having challenges right now, let's say you have an athlete that keeps getting injured again and again, and they're not getting any results doing the traditional model, you may want to tag them on this and share this information with them to give them some hope. And if you yourself are having challenges on the health level, you want to explore the holistic approach with no side effects, please contact us. I'm again Dr. Dennis Mariano. This is Ali. Have a good day. Take care.